If you're watching us live on AAU from the Association of African Universities, and you can follow us on Facebook and on YouTube. Today we are here to talk about early signs of mental ill health in the youth. And HealthAfrik is the only program that prioritizes your mental health. This season we are concentrating on mental health. You don't want to miss this show. Please stay with us. And I'd like to introduce our guest for today. I'd like her to introduce herself though. Hello, doctor, you're welcome.
Hi, thank you very much for having me.
Okay, so I'd like you to introduce yourself to our guest.
Okay, so I'm Dr. Dansoah Nuamah.
Right.
I'm a senior medical officer and a resident in psychiatry at Pantang Hospital here in Accra, Ghana.
All right, that sounds interesting. This means our conversation today will be more than interesting. You don't want to miss anything. Okay, so like to get started. I'd like you to help me define or explain who a healthy human being or a youth is.
Okay, so first of all, when you say someone is healthy, we are talking about the person being in a state of complete physical, psychological, social, having all these components in a good state, okay, and not just necessarily the absence of illness.
Okay.
So when someone is says, I have a pain here, I have a pain there, that mentions a particular illness, that alone does not say that the person has ill health. Even though the person may not necessarily complain of a particular pain, they can still be an unhealthy person. Then we come to the term that is youth.
Okay.
And well, that term is quite fluid. Different people use it in different instances. So for some institutions like the United Nations, they will look at an age range that is between 15 to 24. And if you look at WHO as well, they'll use similar, 15 to 24. But then as said, based on particular instances, that may be modified. So for with Ghana's youth policy, for example, and even Africa's youth charter, that definition is expanded to look at age ranges between 15 and 35. And the main reason is that youth is basically not a fixed thing. It is a period of transition. So when someone is transitioning from childhood dependence into adulthood, where you're kind of independent, and then also learning about interdependence in the community, that is a period of youth. So it's not necessarily a fixed stage per se, but then it's fluid. But for Ghana, we tend to take 15 to 35. So I think we can use that for our discussions as well.
Oh, okay. Okay, so what causes mental illness? Or who can this affect?
Okay, so we talk of mental illness, two questions in one. What causes it, and then who can it affect? Okay, so when we start with what causes it? Well, it's multifactorial, to be frank. That is to say that there's no one cause to it. Okay. The various factors may include biological factors, so we can be talking about hereditary components, hormonal neurotransmitters in the brain. That's basically some fluids or things in the brain. So that's one component that may go amok or amiss and then lead to this. But then also, in as much as these components are there, there's also the environmental factors. So things in one's life, stress, particular instances that may occur, that may trigger some of these episodes are also really, can also affect someone to develop a mental illness. So these are, in simplicity, these are some of the common factors that kind of lead to mental ill health. Okay. Now, who can it affect? Anyone and everyone. Once you're a human being, you're alive, you're breathing, it can affect you. And the thing is, it has no respect for person, for finances, for race, for backgrounds. We have people like even the royal family, Prince Harry, coming out openly and stating that, look, he's had his own challenges with mental health issues. And for us, I think that was a very big step for mental health, because the thing is, if a very close-knit family that's very tight-lipped about everything can have a rep come out and say that, look, this is real, this is a challenge, and we should address it, then I think it's very, very important. So it can affect anyone. And at work, I see it across board, from people in governance to pastors to doctors to bankers to students. Anyone and everyone can be affected. And that's the thing about mental health. Once you have a brain, you can have a mental problem.
All right. Okay, so what are some of the, since you're talking about the youth today, what are some of the warning signs that your child or your upcoming youth in the house could be having mental illness or something like that?
Okay. So just to put things in perspective, when we say mental illness, it's not a diagnosis. So for example, how we say physical illness, you know, it's a broad term. Under it you have various conditions, various diagnoses in there. So you can have malaria, you could have hypertension, you could have diabetes, you could have a stroke. All of these are different in nature, but then they're all physical ill health. Same with mental illness too. There are different diagnoses in there. And that means that there will be different ways things may manifest, the disorders may manifest. So that's just to put in perspective. So no one really expects that they are going to find A, B, C, D, E before they say it's a mental illness, let me seek help. Now, with a basic rule of thumb that can help to pick up early signs is one, if you notice the person who, a youth, whoever you know, is having a change from their usual state. So you notice that the person is not really themselves. Sometimes you may not really even be able to place a finger on it, but then this change kind of is pervasive, and it's not just one-off, it's kind of lingering and then progressing, sometimes even be worsening. That's a cue to get help and to just seek clarification at all, if anything at all. So you don't really have to wait to say this in particular is a mental ill health issue and I'm going to seek redress for it. When you're talking about early signs, most of the time it may be something you may not really even be able to pick up, but then once you notice a change that is pervasive, that is going through, then it's good to have a second one. So for someone who is a bit outgoing, you notice that person is a bit more withdrawn, or someone who is a bit withdrawn now all of a sudden talking incessantly and keeps going on and on, and it's difficult to stop, you know. Someone mood changes, you notice that the person's mood has changed and it's persistent. You also notice, for example, that sometimes common, out of these ones, they are common, those ones people kind of jump at it. For example, if someone starts talking irrelevantly, those people will quickly kind of seek help for. But then the subtle ones are where people are not really themselves. You can really notice there are some changes, but then you can't really place a finger on it. Some of these things are just good to get a second opinion about if you're not unsure, you're not sure about it. Okay,
so if, let's say in a week, I get moody like 4 times in a week, and it's throughout the day. Today I'm happy, tomorrow I'm not, then the next day I'm also not. Is it as a sign, or is it because something else? Maybe there's something else, not necessarily mental related.
Exactly. So that's what I was mentioning about the pervasiveness of it.
Okay. So
oftentimes, well, to make diagnosis, you kind of use timelines. So, for example, you'll be looking beyond some number of weeks, months, and all of those things. But then if I'm coming from a person who is a relative or who is caring for another person, it would not be too fair to say which particular time period, because mind you, it depends on how intense these symptoms may be. So though it may be brief, for example, it may be very intense, that will make you want to seek help. So for example, someone whom you know to be very outgoing, all of a sudden you realize that the person is withdrawn, the person is not eating much, the person is not talking as much, and one day you come home and see that the person has written a suicide note. It may be just a week or two that you may have noticed that about the person, but then for that you immediately seek help. Unlike other instances where you may notice this over a rather prolonged period of time, those are main indices. And then again, a good rule of thumb is when the person's change begins to affect their functioning. So you realize that the person is not as functional as they were. It could be with family, with work, with other peer relationships as well. All of these are good indices to use to try and seek help for such a person.
Okay. So you talked about how to identify it. How then do we combat this?
Well, that is the thing. Because when we talk about mental health, basically, oftentimes it's ill health and health kind of has a thin line in there. So sometimes these things are not too unusual. We can't all be happy all the time. We can't all be sad all the time. So it's fluid in there. But then the determining factor as to what becomes something that needs to be addressed oftentimes comes from the frequency and then the intensity. Now, when you're talking about combating it basically needs us to be open about it first of all, to be able to free to talk about it. The level of stigma surrounding mental health in general doesn't make it too easy for people to even seek help. So you have people who would have symptoms that would be lasting for long periods of time, unable to just get the help they need because they are afraid of being stigmatized. So I think personally one of the first steps we can even take in trying to address these is to talk a bit more about it, let people know that it is real, and it doesn't make you any less if you suffer from these. And also, once you're able to get help early enough, your outcome or prognosis is good. Okay, so the sooner you get help, the sooner you're able to get back to being healthy and stay healthy. But then once we allow this to go on for long periods of time, then recuperating becomes a bit more challenging, and then the outcomes sometimes may not be as good. So education is very, very key and vital. We need to talk to people a bit more, get the word out there, and then also try and help with the stigma. It's terrible. The stigma around mental health is terrible. And I think it's every bit we can do to alleviate that would go a long way to helping everyone who is affected to get the necessary help.
Okay. You talked about people coming out to talk about. So in your line of work, have you come across people who come to you and say, "Doctor, I think I have a mental problem, like I need help"? Like, do you have people coming to you that openly to talk about it? Yeah,
it's not as common, but then often I have seen quite a number of people, and I must say I was very, very impressed.
Wow.
The thing is, with our society, putting things in context, oftentimes when all these changes, it's not as if though we don't notice these changes, we do. But then the interpretation we give to it oftentimes is that it's a spiritual thing.
Yeah.
So most of the time, the first point of call is a prayer comes, a church, a religious institution. So the thing is, picking up these subtle signs and symptoms, we do. But just that the connotations we attribute it to is often of a spiritual origin. So that's how come we kind of send more people to prayer camps. Now, fortunately, there have been some few who have realized that, no, I'm actually having this challenge. I think it's a mental challenge, and have come to seek help. Most of the time, though, is the other way around. Either people are referred for treatment, or relatives or other people around them kind of forcefully bring them for treatment. But hardly do you get people coming on their own. But then I have been fortunate to see a few of such.
Wow.
Which is refreshing.
Okay, so I'd like us to move on to talk about oppositional defiance disorder. I'd like you to educate us on what it is about.
Okay, so oppositional defiance disorder is one of the many disorders that's captured under the umbrella of mental health disorders. Okay. And it comes mainly under one of what we call conduct disorders.
Conduct.
So basically, I think the name kind of helps us understand what it is. So it's basically people who tend to be a bit more oppositional in that they are a bit more argumentative, uncooperative, and sometimes can have tantrums. Okay, and then defiant. Defiant basically says kind of disrespectful, not really bothering about who is speaking, whether it's an authority figure, and with children, irrespective of whether it's an adult they are speaking to. Okay, and the disorder, oftentimes, I know once in a while you see people have this, so it's not like everybody has oppositional defiance disorder. There's a strict category, diagnostic criteria we use in making the diagnosis. But then again, just to make it simple, oftentimes it has to be pervasive, so it has to last for a period of time. And in a week, it has to be most days in a week for at least 6 months before such a diagnosis is actually made. And then the content of what goes on in there. For a preschooler, and it happens from childhood. So like, let's say preschooler who is throwing a lot of tantrums and is not respectful and is very argumentative and gets into these huge, fiery arguments with people in authority and also people who are older than them. Those are those are the main things you look at in there. Mind you, with this, it can be in one particular situation. So for example, for some people it may be more of in the home situation, but in other settings they may not necessarily exhibit such behaviors. The only thing is that it shouldn't just be restricted to just siblings, because you know, with siblings it is kind of quite common. But if it's other persons other than siblings, then you can be looking at such a condition. And it tends to come in with other comorbidities, so it may come in with other conditions as well. Commonly, you may have some mood disorders, so like maybe depression, anxieties, those could come along with it. And then also as you're growing up, it's can also come along with substance use disorders as well. So it's something that, it does not say it always develops into that, but it may. And as I say, as they are growing as well, it may also develop into what we call antisocial personality disorder. So that's where it kind of graduates into something else altogether. But along those lines of not conforming to what society expects of them.
So when you were talking, you talked about the fact that they don't obey rules or they are disrespectful towards the elderly. Okay, I know someone. I can't mention names here, but she's also like that. But because we are siblings, I don't see it as a mental something, but talking about the fact that it has to be with everyone, not just siblings, doesn't mean that she has, but then it's quite mild, or she doesn't have at all. That's just a character or an attitude or something like that.
Exactly. So when you're going more detailed into the diagnostic criteria, then you look into the onsets and then also look into the settings where these symptoms are exhibited, because as I said, sometimes it may be a response to certain environments. So for example, if there's harsh parenting or a home environment that may not be necessarily too conducive, sometimes that response may be in response to what the environment is throwing at the person. Then again, sometimes too, it is like the harsh parenting may be in response to the person's behavior and personality. So it takes time to sit down through a history and then tease out exactly where it is. And the main aim is also trying to identify the triggering themes and where the challenges are, so that when working with a person to overcome this, then you are able to address all of these. So it's quite difficult to blanketly state that the person has or does not have a condition. Also, as I said, often look at when it started, the onset, and how it has progressed with time, the settings in which it's manifested, what may trigger it, or what may be, who the person even has such tantrums towards, and then what these issues may be that leads to such behavior. So it's not too good to just blanketly give people diagnosis and tags, but then just to give us an idea of basically what goes into it. Those are the main things there.
So how can this be combated? Because it's serious. If you're like that, somebody will say you are disrespectful naturally, but you might be having a mental problem.
Exactly. As with most, especially personality and other disorders, there's a thin line between the normal and then the not so normal. Exactly. But then with combating is one, first of all, with whatever concern you have, seek professional help. Once you seek professional help, then the full history is taken, and then the challenging areas or where the problems are identified. Even if it's not a diagnosis that is labeled as oppositional defiance disorder, there is definitely conflict that's going on in whichever setting, and their requisite tools may be used in trying to address them. Amongst them are psychotherapy. So there are different modalities of psychotherapy. Sometimes we even have to do family therapies to also try and just make sure that whatever the main issues is that's underlying this and causing all of these to be present are addressed. So we may do different modalities of therapy based on the particular needs. And if necessary, as said, sometimes with comorbidities, even with children, and maybe with ADHD, attention deficit hyperactive disorder. So if it comes along with all of these other disorders, certainly they must also be addressed. So for those, yes, sometimes psychotherapy may be used. At other times, to pharmacotherapy, that's where medications may be needed. And also social support and all of those are also looked at. So we tried to address these from a 360-degree kind of approach, addressing every challenge in a holistic manner, rather than just labeling someone and then kind of putting them in a compartment.
So we are informed about some of the most common childhood disorders, that is anxiety, depression, bipolar disorder, attention deficit disorder. Can you kindly explain all these things, because they are very big?
With the diagnosis and the disorders, they are quite a lot. But then with childhood and adolescent mental health. These are
Okay.
quite common disorders.
Yeah.
So I'll try, I think what I would do is I would try and pick some of them and then kind of give some basic things about them.
Yeah.
Okay.
Oh,
So to start with, for something like depression or your mood disorders, I think that has come under a lot of limelight of late with episodes that have been going on. But basically it's sustained low mood in persons, which may be associated with other symptoms, commonly symptoms like reduced appetite. For some people, they may have increased, but oftentimes a reduced appetite, reduced energy, difficulty concentrating. Also, people may also have a sense of hopelessness, sense of worthlessness. So it basically means that they feel like the future doesn't hold much for them. And then that's a very difficult place to be in, sense of worthlessness, where you feel as though you don't really value, you don't have much worth, and generally feeling very down and low about yourself, low self-esteem as well. It comes along with other symptoms like persons also sometimes having suicidal ideations, where they feel so down that sometimes they believe it's worth not being alive at all. And these may be very persistent ideations that sometimes people may act on and actually attempt suicide, and unfortunately some do succeed in completing the suicide. So basically that's depression, and as I say, it's not necessarily just one day you feel sad and that means you're depressed, but then it must be lingering for a period, longer periods, weeks or more, then we are looking into a depression episode. So that's, and I think, a good summary, fair enough summary about what depression is. And with it may have a triggering factor, so there may be something that may trigger it. Sometimes there may be nothing really that may trigger it, but then the person may still experience the slow mood. Yes. Then we look at the bipolar affective, which is also another mood disorder. And with that, as the name suggests, there are two ends of a pole, basically. So at one extreme end is the depression phase, which is spoken about. And then at the other extreme end is what we call the manic phase. And so it's not that the person is experiencing both at the same time, but the person alternates between these two poles. And there may be periods of normalcy in between these extremes. So it's not as if all the time there's one or the other. The person may be fine for a period of time, have maybe a depression episode, then it may limit itself, then with time may have a manic episode. Everybody is a bit different, so it's not like there's a routine for how it goes. Someone may have more of depression episodes in their bipolar, another person will have more of manic episodes and maybe just one depressive episode. The manic episodes basically are manifested by persons having a lot of energy, so it's like the other opposite. So like a lot of energy, maybe talking excessively and very rapidly, decreased need for sleep, maybe having a lot of ideas coming to mind, but they're never really completing. They may start the project, but they're never really completing them. So it's like one thing to the next, on to the next. They may also be spending quite a lot during this period, feel very generous. And some may also taking very risky behaviors. So during this period, people are maybe a bit more sexually promiscuous. Libido will be increased. And also during this period, it's also a lot of creative periods. So people get a lot of good creative ideas, and we have a lot of popular people who will be able to use the creativity from these manic episodes. So the mood is expansive generally during this period. Also, they may be very irritable. And sometimes it may be associated with psychosis, where the person may be hearing certain voices that may not really be there, seeing certain things that may not really be there, and then also sometimes have beliefs about certain things that may not really be true. So they may have very grandiose delusions. That means they may have very high and lofty beliefs about themselves, which really may not be the case. So that's basically how bipolar is. So it's kind of moving between these two extremes, and as said, one may be a bit more on one side, another person may be a bit more on the other side.
So before we move on to autism, which is another disorder, I'd like to ask, way back in senior high school, there was a girl. But when her bipolar comes, she passes exam like something, you know. She will just score everything, and I'm like, when she comes back to normal, then her performance falls. How does this affect your performance in school?
Exactly. As said, from what you're saying, it sounds like she tended to do very well during her manic episodes, because with depression, it's difficult to really even concentrate or do much. And the thing is that bipolar persons are quite brilliant individuals.
Oh, really?
Yes. And during a manic phase, as I said, you may have, there's so much energy. You can really absorb a lot of things you're studying, and you may be able to get so much within a short space of time. Mind you, also there's a decreased need for sleep, so the person can just keep going without really feeling tired or needing to rest. Okay, and during this period, people can very brilliant ideas can come out. We've had good presidents and all of that having the condition, so it's not all bad. The main issues are when this leads to the person taking risky behaviors. Okay, so maybe for example the person is driving and speeding, reckless driving, because they're feeling that high, they're feeling indestructible, so the person, as I said, to spending, for example, the person may go and make a huge mess of their finances because I had one patient who went to a club, right, and then it's like free drinks for everybody, and he keeps spending. All of a sudden the bill is in like thousands of dollars, and then he gets arrested and sent to bars because you just keep feeling that great, that you keep doing things over and beyond what is necessary. And sometimes the delusions too maybe make someone act in a way that may not really be right, and that may lead to the person accidentally harming themselves.
So we can move on to autism disorder.
Yeah, so with the autism spectrum disorders, it's also one of those that is like during childhood, and it's a spectrum, so there are different degrees to it. But basically, the two main components are one is difficulty in showing emotions. So the person has restricted emotions, so verbal, they may not communicate back and forth as you will be having, and also non-verbal, how to use non-verbal cues in communicating may also be a challenge.
Thank you very much, Doctor. We'd like to go on a short break, and when we come back, we are going to talk about attention deficit hyperactivity disorder. Please stay tuned.
What do you think about when you think of success?
Success is about hard work. Success is about knowledge and applying it for the good of the community. Success is about skills development. It's about creating innovative ideas and building a hope and making it a reality. Success is about having big dreams and chasing them. Success is nurtured here. We as National University of Science and Technology stand as the only key you can use to unlock doors for success. When you think of success, think in other terms.
Welcome back from the short break. We are continuing and we are talking about attention deficit hyperactivity disorder. Doctor, can you explain that?
Okay, so with that again, I think the name kind of helps give it away. So we talk about two main components. Three actual main components. We are looking at inattention. So basically, a child with such a condition basically is unable to maintain attention for long periods of time. So oftentimes you have teachers complaining that they don't pay attention in class because they are always up and about doing something else. So within a short space, they may pay attention, but after that it looks like they are distracted into other things. Then again, the hyperactivity. So you basically can't sit still. Always has to be on the move. Even when they're sitting, it's like they're fidgeting or with something. So it's just cannot be still. You have to keep moving, you have to keep doing something. And then the last aspect is impulsivity. So person spontaneously does things. So let's say that child in class that even before you ask the question and they blurted out the answer, everybody knows you have to raise your hand before you answer, but no, for them, once the question is coming, then they just keep blurting out the answers. They're just very impulsive. So those are basic things about it. And as I said, it's pervasive and sometimes it's disruptive, so that even in settings where you'd expect them to be able to comport themselves, they kind of are a bit disruptive. So their functioning it gets disturbed because of this these three main components. Then that's in short what the attention deficit hyperactive disorder is.
How do young people who have had mental ill health recover as they age? Do they recover as they age, or they recover instantly, or it's like they recover as they age?
Okay. So it's a good question to ask. And the thing is, as said, there are different conditions that are covered under mental health. So it depends on what type of condition it is, and then how it's tailored to progress generally. So one, the type of condition the person has, that determines is one of the things that would help determine their prognosis. Secondly, to the health-seeking behavior of the individual. So if in the timing of the health-seeking behavior, so if symptoms start and then help is sought early enough and interventions are made early enough, and patients stick to the interventions that are given as recommendations, then prognosis oftentimes is very good. So you may have someone who may be diagnosed as even bipolar, getting on treatment, maybe using both their pharmacotherapy medications and their counseling session, their therapy sessions, tools, and you see that they'll be very fine, work normally, be able to grow well, go through school without much disturbance, marry, have children, have a good family life. But then for a similar person with a similar diagnosis who, for example, does not even seek treatment early, or even after seeking treatment does not stick to the treatment regimen. So for example, you put a person on medication and this person doesn't take medications, they take it as and when they feel like it. For such a person, oftentimes you end up having what we call relapses. So relapses basically means you end up having more of such episodes. And research has found that the more of relapses someone has, it does not help with the prognosis long term. So based on some of the conditions can be very debilitating. So if you're looking at a condition like something like schizophrenia, which affects youth, yes, if you're able to stick to your treatment, you can have good functionality. But if you don't and you have more relapses, sometimes you become quite a burden to family, and that's when all these social issues become very, very dicey. So there can be good progress made, but it just depends honestly on the person and their family in health-seeking behavior.
So how do we address the rise of mental illness among college students? Because it keeps increasing.
Yes. So I think the college environment is just a reflection of society generally. And it may seem, well, it's one of two things. It may appear as though it's increasing, but then in actual fact it could be that these are things that have just been there all along, but then we're not being spoken much of. So now there's a lot of attention to it. So for example, people may have been committing suicide, but just that it wasn't getting as published in news and all that because it was something you don't talk about. You know, after there's a taboo to even talk about such a thing. But now there's that space where we can talk about these things. It may create the impression that there is an increased rate of it. So it's here and there. What to do about it basically is one, accept that these are the realities, because most people are in denial about it. Oftentimes it's very difficult to get in and understand, because once someone is told you have a mental health issue, it is a big deal. And it will be difficult to pretend as though it isn't, because it changes a lot of dynamics for you. And even in our society, it kind of taints everything a bit difficult. I understand, because even with health professionals, once you mention someone has a mental health disorder, then others who may not necessarily be in the mental health fraternity kind of have a certain way of looking at a person. So there are definitely challenges that have to be addressed. But I think first and foremost, once we start, as I keep reiterating, talking about these things and making people feel comfortable enough to talk about them, so that, because these issues are there and the rates are so high that you know that it's going to be something that's going to be present. But then people feel comfortable enough to actually even talk about it with even close family
Okay.
then even getting to seek help and be open about it. That is the only way we are going to get things getting better. Then again, when it comes to institutions that are responsible for caring for persons with mental illness, there has to be adequate equipping of our institutions, both with human resource and then also other resources as well, financial and all of those things. You just have to make it such that it is such an important issue that I don't think it can be I don't know how it's not prioritized enough, because this is the minds of people. And when we're talking about youth are people who are going to be in places of leadership very soon.
Yes.
So we have to do everything to make sure there's a space created for people to feel open enough about getting help. And also when they seek help, the institutions they seek help from should be equipped enough to render that help to the best of its ability.
Okay. Moving on to career guidance centers or counseling centers.
Okay.
These counseling centers in schools and universities are poorly patronaged. Do you think this low patronage in itself has an influence on the stress on students causing their mental illness?
Well, it's good. I think it's a very good and laudable concept, having the career and guidance setting. The low patronage is something we should actually look at. And for me, I think it's basically a reflection of the issue and challenge of stigma. Because most people don't want to even be associated with anything that has to do with mental, and even the thought that another person may know that I walked in there, it becomes a difficulty. So it depends on how the centers are structured. I can't say I can speak to all of the structures, how they are, but then oftentimes now mental health is moving to a place where we're trying to decentralize from the main hospitals that we know of, but then getting units in various hospitals, general hospitals, so that it's easily accessible. And so a similar concept may be used for the career and guidance units, such that it's not, when you're walking in it, it's not so obvious that you're walking into a place. Exactly. So it may, based on how the setting is, people may feel a bit more comfortable going in and patronizing it. Example, if, for example, it's in a general students clinic, and then one of the consulting rooms is assigned, and maybe you swap which room it is every other day, so that it's not as if a particular room gets tagged as this is the psych room. Then it may help people feel a bit more comfortable getting help. But then little by little, I think we'll get there. Now, the low patronage, the question was if that doesn't...
If that also has a toll on the fact that youth, they are also developing mental illnesses.
Yes, so the thing is, once you have stress in a college setting, and stress is nothing so big, you don't necessarily have to complete university before you start going through stress. Even getting how you even manage, during that time people are finding themselves, relationships, issues and all of those things, they are a big deal. So stress will come even with examination classes, grades. These are important stresses that are real and exist. So those already in themselves are factors that may tip someone who is already predisposed to having a condition, tipping them into actually having it manifesting in its fullness. So that setting on its own definitely is going to be a factor to lead to people to having these things pop up. And then again, it's a period of a lot of experimentation, peer influences, so drugs use and alcohol use, substance use is quite on the high as well. And then there's undue pressure nowadays to also be, keep abreast with the times and keep abreast with appearances. So there may be pressure, especially for someone who may be coming from a background that is not so affluent. And pressure on how to keep up appearances and try to fit in with peers and try to not be different. So there's a lot of stress during that period. And so all of these are reasons why these centers should actually be well patronized, so that people are helped.
So talking of stress, in a workplace, what could stress an employee to develop a mental disorder in a workplace?
When you ask that question, in my mind goes like, what couldn't stress? Because like anything and everything can be a source of stress.
Yes, okay.
And when you're looking at occupational health and safety policies, oftentimes you would have it looking at the biological components, the chemical components, and all of those. But then the psychological component is also a very, very important component that has to be looked at, especially by employers, so that they know how to address it to keep their their employees in a good space. Now, stress can come from anywhere. For example, even techno stress. For example, using of technology nowadays. Imagine someone who had been in a setup where, when the person was getting employed, computers were not being used. The person was used to doing manual work and all of that. And all of a sudden, you have to use this digital system. It is a sort of shift, because now all of a sudden the person has to relearn and feel as though if I'm not able to, I may lose this job, you know. For example, where I work, Pantang, now there's this whole using of hospital administration management system. So that means you're going to have to take histories with a whole computer. And something that can be written in about just 5 minutes, all of a sudden it has to be typed out in a long space of time. So that in itself is going to be a stressful thing. Job security, people feeling that they can easily lose their job. With some bosses, they keep threatening, I'll fire you. I mean, it's a source of stress for employees. Then again, also sometimes even with remuneration, even just job schedule, timing, the person cannot even have enough time for themselves or for home, or feeling like even the shift work, some work in shifts. So if the person is coming for 9 shifts back to back and then has to come for another shift, if the hours are not adding up, that is in itself a source of stress. So there are a lot of things that has to be looked at when it comes to stress in the occupational setting, and it's good if we have good occupational health and safety documents, so that the implementation of these is a bit challenging.
So wrapping up, I'd like you to tell us, what should I do if I realize that someone is having a mental illness or a mental disorder? What can I do to help the person?
Okay, so a lot can be done. First of all, if you're in a space to talk to the person about it, you can do so. Mention what you've observed, and then encourage the individual to get help. The person doesn't necessarily even have to rush to a psychiatric hospital. You can go to a general facility, speak to a doctor, and from there get the requisite referral. Now most centers across the nation have what we call community psychiatry nursing units. So there are units there with persons who have been trained to help address the minor issues, so that major ones can be referred. But the key thing is get help, because you can't do it on your own. You don't need to do it on your own. There are people who are well equipped and willing and eager to help get over it.
So do you think the introduction of first aid mental health, like things in schools, like primary schools, secondary schools, universities, will help salvage the situation? Just like we have first aid kits in schools, if we have something like first aid for mental health, will it help this whole thing?
Well, I think it has a potential to help. It just depends on how it is executed. Based on how it is done, it will determine whether it becomes having a challenge like the career guidance institutions where people are shunned away from, or is something that others can feel welcome into. So training of the individuals who will be responsible for it, so that confidentiality is maintained, you know, all of these little nuances, those are the determining factors. But as of now, with the way things are going, I think every opportunity to be creative about it should be explored, and I think it has a good potential to be beneficial. It has a good potential.
So our last and final question is, what's the role of the government here? What can civil society organizations do, private entities, what can they do in the fight to ensure that mental health is something that we all pay attention to, and then we can help each other in this fight?
Okay, so that's a good one. For government, I think a good place to start will be to honor their obligations, especially to Mental Health Authority and then to mental health institutions in general. There's this clause in our legislature that's basically saying that mental health care is free. But then free comes in because someone else is paying for it, and that's supposed to be government. So when government is not paying and patients are trying to access their care, then it doesn't become as free as you would like. So if those funds are channeled to the institutions, that would be a great source of help. With civil society, with NGOs and other institutions, I'm sure all mental health authorities eager to partner. All the hospitals are, and we don't have that many. We have Pantang Hospital, Accra Psychiatry Hospital, and Accra Hospital. So you can speak to any of these, and there are a lot of avenues by which individuals can help. So I think once you come, we'll open up and talk to you about whatever you want to do, no matter how small or big it is. There's always room for collaboration. Be it pure psych, be it substance, be it child and adolescent mental health, be it even for women. I mean, it's limitless. There's always room to help.
So your final words? My
final word is the age where mental health has to take its place, where people have to pay attention to it. Stigma is not helping. It's making things much, much worse. And we have to be able to talk about mental health issues now. I'm happy we are doing that today. And I just pray that we keep doing it so that we get to a place where others like Prince Harry feel comfortable enough to come forward to help others to also get the help they need. Once you get the help, you can actually do very, very well. So it's not a tag that is like of doom or anything like that. There's always light at the end of the tunnel.
All right. Thank you very much, Dr. Nuamah. Thank you for honoring our invitation.
Happy to be here.
Okay, so the stigma is not helping in the fight against mental health. We have come to the end of this edition. Thank you very much for watching, and we'll be here same time next week.